The idea of outpatient joint replacement has really caught on in the last few years. By outpatient, I mean a surgery that's done in the morning and the patient goes home that afternoon. This is a concept that even just a few years ago was really considered to be renegade, but it's no longer. There are several thousand cases that have been done in the United States now. The outcomes actually are better than people who have the surgery in the hospital. Fewer readmissions to the hospital, better pain management, lower infection rates. One of the things that I've been doing in the last couple of years that has really revolutionized my practice is outpatient knee replacement. This is an operation that even 10 years ago, people were staying up to 5 days in the hospital. And one thing that we have learned is that people do a lot better if they just sleep in their own bed. Hospitals are full of infection. And let's face it, you'd rather wake up to your own family if your pain can be well managed than be in the hospital. Patient selection in outpatient knee replacement is very important. It needs to be somebody who has the mentality that they're going to be able to go home after surgery. Obviously, they can't have any comorbid conditions that would preclude their ability to not be in a hospital, like coronary disease, risk of stroke. Somebody that is morbidly obese probably wouldn't do well with outpatient surgery because they're going to need a little bit more help with physical therapy. But there are definitely a subset of people who really do a lot better with outpatient knee replacement. The way it works is the patient comes to the ambulatory surgery center in the morning and they meet the anesthesiologist who will do what we call a motor sparing nerve block. So using an ultrasound machine, they will numb up the nerve around their knee to the point where the knee is numb, but they can still use their muscles in their thigh. It's huge, because this way they're going to be able to walk out of the surgery center in a couple of hours after they have their new knee. They have their knee replacement just like we've been doing for the past 30 plus years with the cutting blocks and the metal and plastic implants that go into place. They go to the recovery room and they sit there for an hour or so, get up with physical therapy, do some walking around, and they're out the door. And you can imagine somebody who has their knee replacement on Monday and they go home Monday afternoon, and their best friend has their knee replacement on Monday and they leave Wednesday afternoon. The mindset is dramatically different. You've got somebody who's been home for 2 days, they're already back to living their life, they're eating food in their own house. Very motivated, showing that they're going to get back to a normal life. That was the point of having a joint replacement versus sort of the infirmed, lying around the hospital for 2 days. For those of you who are considering a knee replacement, I would implore you to explore the possibility of doing it as an outpatient. You're going to want to find a surgeon who has a lot of experience with outpatient joint replacement and who works at a center that understands the protocols around outpatient joint replacement.